It is Thursday, November 19th. Joe Del Jets. Welcome to the Kahnawake COVID-19 Task Force Daily Update on a cloudy and cold Thursday afternoon. Glad you could join us. On today's program, we'll be talking to Derek Montour, the Executive Director at Sigotyetegenhas Community Services, talking about coping. That's coming up in just a little while. As you know, if you've been following the news at all, COVID has overtaken the headlines as the rates continue to rise, not only in Quebec now in Ontario, but across the country. The death rate is scary. We in Kahnawake, of course, seem to be steering a good course. We need to continue to do that. And to give us a bit of an update on our situation is the Commissioner of Public Safety, Lloyd Phillips. Lloyd.
Thank you, Joe. Good afternoon, everybody. Yeah, as Joe was mentioning, obviously most of us watch the news on a regular basis. The situation, not only in Quebec, but across Canada and across the U.S. is continuing to accelerate. And now we're seeing places such as Manitoba and Iqaluit and stuff that went relatively unscathed during the first wave are suddenly seeing a major surge in cases. And then also, in Ontario, they actually this week was the first time they actually surpassed Quebec in their numbers. Unfortunately, Quebec, we've seen some dips in the new cases every day, but the 7-day average is still about 1,200 cases per day. And unfortunately, the death rate is gradually and steadily increasing. So there has to be measures taken, outside the community, within the province, to help curb that spread. And actually today, about 5 o'clock or so, Quebec government is going to be having a press conference where they're going to be announcing several measures, regarding their schools and some issues regarding Christmas and how they plan to handle the next several weeks, moving towards the holiday season. And obviously, as we always say, we watch what they're doing, we assess what they're doing and see how effective it will be. How is it relevant, to Kahnawake, and then sometimes we'll adopt the measures that they're doing because it makes sense. Other times we do something differently. We have been and are still in the process of evaluating various options, for the holiday season. What can be done safely. We're not ready to announce anything at this moment yet, but we will get something out to the community as soon as possible. And we understand people want to plan. But one thing I could say for sure, obviously, if you compare from last year to this year, Christmas holidays will be certainly much more within individual households, or only a modified group of your family members, again, to keep things safe. But we'll roll out some more details on that as we go, because I'm sure by the end of the day today you will be hearing much more from the province of Quebec. But keep in mind, as I always said, that applies to the province, not necessarily to the community. It's again something that we watch closely. We have been faring fairly well within the community. We do have currently 2 active cases in Kahnawake. The testing site is still open, averaging about 12, 15 people per day being tested. And I want to emphasize the fact that that is available. You can always call the Kahnawake Hospital. If you suspect that you have COVID or you have any symptoms, you can call there. You'll be assessed over the phone, and then you will be asked to come in if deemed necessary for testing. Testing is still, the #1 way for us to curb the virus, the spread of the virus. That way, if somebody is positive in the community, it's identified quickly. That's one reason why we have our testing center. It's identified as quickly as we can. We have our own public health team that could do the contact tracing immediately, so that anybody who was in close contact with a positive case is informed and isolated accordingly. And through the measures that we had throughout the community, the cooperation of the community, our own public health team, the testing center, and the guidance from the task force, all combined, has put us in a position where we're faring fairly well throughout the pandemic. With that said, I always say that with a caution, because things could change drastically in a matter of a few days. That's why we're always talking to the community about maintaining our vigilance. Let's not get complacent, and now is the time again to stay strong, and keep moving forward, because there is some light at the end of the tunnel. As you've been hearing on the news, there's some talk about vaccinations coming out in the early part of the new year, and two different possible vaccinations that will be spread out throughout Canada. But even if there is a vaccine that comes out in say another month or two, it will take time for that to roll out to enough people to get the vaccination that would actually be able to allow us to relax a bit more. So it will take time. Mass inoculation of millions of people will be a very complex scenario to do. And as well, obviously, when it comes to Kahnawake, we'll have our plans in place when that time comes to ensure that we have a process that meets the needs of our community. One of the ongoing topics that have been coming up from community members and from through Facebook and direct calls was regarding some travel, and they want to clarify what it means to be able to leave the territory, going to different zones and provinces and such. So what we did, we had a discussion over the past couple of weeks, and we are issuing a directive that applies to community organizations, executive directors committee organizations, that is specific for employees of the community, and that will be relayed through your individual organization on what the limitations are, or the restrictions on travel. So that will be done from an employer perspective. But as well, from a community as a whole, we want to issue out some information that will help clarify what we mean by the travel. And we did put together a graphic that we will be posting on Facebook and other places after the show, and it will be made available on various medias moving forward. So I want to go to that graphic now, and maybe we could take a closer look at it. If you see on top, obviously, it's a COVID-19 travel restrictions, and it's broken down into three areas. We have one, first of all, within Quebec. Right now, we are living in a red zone. Obviously, Kahnawake, we are in the red, but the greater Montreal area is also in the red, and is not recommended for anybody living in a red zone to travel towards any area that is either green, yellow, or orange. So it's certainly discouraged from anybody traveling, from a red zone into any other part of the province that is less than the area that you're in. And this could evolve over time, because hopefully at some point, we will be able to get back to an orange level in the community, and so that would still apply that you shouldn't travel someplace that may be in yellow or green. So that, I think this is a good indication, a good graphic to look at to get a snapshot of what we mean by travel within certain areas and certain zones. And the zones could change if you're planning something, even though it's not recommended that you travel. But if you have to go somewhere, Quebec.ca actually has a good graphic there as well, where it breaks down each one of the provinces, each one of the sectors within the province, and it tells you what color code they are, so you're aware if you're planning to do travel. On the other side of the page, if you look, it talks about outside Quebec. It is certainly strongly discouraged for anybody to travel outside the province of Quebec. This applies for Kahnawake as well as the average citizen that's out there, that they are highly discouraging people from traveling outside the province. Obviously, there's exceptions that could be made for people who are obviously involved in the transportation sector, people who have to travel because, say, for example, they have shared custody with children, essential service workers, students that have to travel for specific reasons, or some various workers that, again, it's required for your work. So it's again, very specific travel restrictions. And you know, with this, there's also a website that's attached to the graphic that you can click on, and it gives you more details specifically on, for example, what's happening in Ontario or Manitoba or other provinces that people may want to travel to, because there may be specific provincial restrictions that would apply to you. And in some of these cases, if you don't have an essential purpose for being in another location, you could be subject to fines and penalties issued by provincial authorities. So again, you should be aware of that. Now, as far as international travel is concerned, right now, obviously, it's strongly discouraged. As a matter of fact, it was announced today that the border between Canada and U.S. border is going to remain closed for additional 30 days. So, you know, travel, non-essential travel to the United States is not permitted according to the Canadian authorities, and obviously is strongly discouraged anybody to do so. You know, because travel has proven to be one of the largest sources of spread of the virus, especially in areas of the U.S. that are currently seeing major surges in the cases of COVID-19. If you do travel, you know, you are subject to the Canadian Quarantine Act. So if somebody does return, you are subject to a 14-day quarantine period that makes to ensure that if you do get infected when you're traveling outside the country, that you are quarantined so you do not spread that to anybody else. We know that there is the ability for people to travel to other countries such as Mexico and parts of the Caribbean. You can fly out of Montreal. Unfortunately, there's no restrictions for people leaving the country, but there's certainly restrictions for people coming back. Again, these are things that are beyond the task force control, but we are strongly urging and encouraging Kahnawake not to do so. The risk is extremely high in areas of Mexico and in the Caribbean. The healthcare there is not nearly as what it would be, you know, within our area. And as well as you coming back carrying the virus, obviously puts your family and ultimately the entire community at risk. So we're strongly discouraging any travel of that nature. I know sometimes the information could be somewhat you know, contradictory, because if you look on a Canada site, you know, or a travel site, they're still encouraging people to go down and enjoy the sun over the winter. But again, it's highly discouraged. Keep in mind that these resorts, obviously, they are struggling financially. They're trying to lure customers in. But from a purely health perspective, a COVID control perspective, again, it's highly advisable that you do not. If you need to have time off, I mean, look at other ways for you to try to have time to relax and time to spend time with your family. But certainly traveling outside the province is not the way to go about doing that. So I hope that graphic is going to be shared on the Facebook page in just a little while. Also will appear in the local papers. And that's basically what I have to relay for you today. We will be giving more information next week regarding some Christmas gatherings, Christmas visitations, some recommendations and some possible directives on that. So stay tuned and we will be in touch. So with that, I'll turn you back to Joe. Goodbye.
All right, thank you very much, Lloyd. And of course, with Black Friday coming up, that's why so many people have been asking about travel situations. Just a note again, in terms of the graphic that Lloyd was showing, it will be on Kahnawake911.com. You'll also be able to see it at Kahnawake.com. It'll be linked there as well. And just a note that the graphic includes the QR code that can be scanned for even more information linked to Canada and Quebec. So a lot of good work going on in terms of trying to make it as clear as possible and be as helpful as possible. Speaking of being helpful, we had a chance to have Derek Montour, the Executive Director of Kahnawake COVID19 Community Services, provide us with a topic today to talk about, and we talk about coping. That is number one for so many people because it's been difficult. And earlier today, he would have been here live, but he's just not able to, so he recorded this a little while ago, and we hope that it will be helpful for you.
For those who may not know me, my name is Derek Montour. I'm the Executive Director of Kahnawake Community Services. And today is KSCS's turn to be on the Facebook Live. So I'm taping this in advance for this evening's session. What I wanted to talk about really was focusing on resilience during the COVID pandemic and how can we look out for ourselves and look out for each other during this time. Our services here at KSCS have received a massive amount of requests for service, and we're providing it at this point, but part of it also is how can we help each other so that we can focus on those most in need. Hopefully we can continue to provide this level of care and level of service. But during these emergency times, it's really important that we all come together for these kinds of things. And Kahnawake is always so good at that during crises. The challenge is this crisis has gone on a long time, and it'll continue to go on a long time. So that's really why I wanted to talk about resiliency and what can we do on a regular basis. So I found a few things. I'm going to kind of read off some of it and talk about that, and then I'm going to provide you some information that maybe you can follow up on your own and do a little bit of research for yourself. So as we all know, the spread of COVID-19 has caused many Kahnawake to change their daily lives and hope to flatten the curve, as they keep telling us. And the effort really is to avoid a spike in cases that would overwhelm our health services. And our health services are getting overwhelmed right now. It's hot in many different areas, and we're rising. And the deaths are rising, the cases are rising. So it is a cause of concern right now. This is not the time to be lax in this and to hope I can go on a trip. It really is about remaining vigilant with what we can do. For some of you, that has meant we needed to self-isolate for 2 weeks. For others, it may mean you're now working from home for maybe the foreseeable future, and you kind of may feel like almost like a prisoner in your home. Still others have to continue to go to their workplaces and put themselves at risk by going to an essential job or essential nature of their job. And even others may face the prospect of no job and a job loss. These are all difficult situations, and everybody's dealing with it in their own way because everybody has a different way that they respond to stress. But it's a good time to remember, of course, that we all have resiliency skills, and how can we build on those resiliency skills. So first, I would mention that given this, it's normal to be stressed and to feel anxious. It's a normal reaction. Try to avoid or ignore or suppress anxious thoughts, or try not to avoid ignoring or suppressing these anxious thoughts because they normally happen. Instead, try to be more aware of your anxiety and accept that it's okay to be anxious. But what can you do about that anxiety in a positive way? Try to keep things in perspective. I know sometimes it's important, for me at least, is to think about others and what kind of challenges they may be facing. Sometimes even helping others by even reaching out by a phone call or those can kind of put our own lives in perspective, that maybe it's not so bad. Notice and challenge your own thoughts that may be extreme or unhelpful to you. And that self-deprecating thoughts that sometimes we all do, and we kind of make it even harder for ourselves by that internal dialogue that's happening. Secondly, self-care is critically important at this time, as worries and our own worries can be made worse if we aren't taking care of ourselves. So what does that mean? Leaning on social supports, trying to get enough sleep, eating healthy and eating enough, exercising and engaging in enjoyable activities. Try not to be on the TV all the time. Try not to be on Facebook and video games and other things that just focus us internally. Get out and move and do those healthy activities that we used to do all the time, but doing it in a safe way. Do the things you typically would do to support your health. And be sure to use caution, of course, and use health and safety guidelines while doing them. Just because we're doing this COVID, it doesn't mean that our lives end and we're not in jail and our freedoms are not taken away. We just need to do it in a safe way. Seek information from reliable news sources only. There's so much news out there on the internet and on TV, and it's this person says this person says that. Try to stick with certain information sources. Limit the amount of you're taking in. Only do it for defined periods. Take the recommended precautions as outlined by Health Canada and others, but remain focused on factors that are within your control, such as washing hands, covering your mouth during coughing and sneezing, wearing face masks, avoiding any non-essential travel. If you're noticing that your symptoms of anxiety are causing you significant stress or interfering with your ability to function, then reach out for mental supports. Those are what we're there for. So what can you do? First, I found one. This was from a site called The Working Mind. So I suggest you take a look at that site. And on here it shows the same kind of category of green, yellow, orange, and red, of kind of asking yourself, how am I doing and what should I be looking for? So in this, for example, it talks about when you're green and you're healthy, you're using your normal, simple coping tools. You're walking, you're talking to friends, your music, your limited news and media. When you start realizing something is changing, maybe what has changed? And you need to ask yourself, has changed? Is your sleeping patterns changed? Your eating, your daily habits? And then maybe start trying to get somebody to help motivate you. When you're into the injured or orange section, now you're starting, maybe how long have I been this way? If it's for an extended period and you're not able to get yourself out, then maybe at that point you need professional help. And then finally in red is, I need help now. And those are in crisis. Maybe you're in a severe depression and you have thoughts of suicide, or you have thoughts of hurting yourself or others. Get help. Call. Go to Anna LaBear's. Go to the emergency and ask for help at that point. You don't want it to be late, and we don't want it to be too late for you. Also, how can you help others? Acknowledge and listening to other people. You may need to reach out for your own mental health, but by you reaching out, the other person benefits as well. So it's not just a one-way ticket. Don't think that you're burdening somebody by reaching out and talking to people. Review the facts of what's going on with you. You may not need to go into details about it, but at least starting to have a dialogue or a discussion. Reminding your teams to check in with themselves and your friends and your family. So you may be doing it. Remind others to do the same. And remind them about good coping strategies. Respond and follow up. Observe your teams and check in with them afterwards, especially if they say, hey, I had a really rough time. Check in with them the next day. See how they're doing. The last thing I want to share before I sign off for today, because I know there'll be others with Lloyd and Lisa that may be going on, but is on the Working Mind website, they had this self-care and resiliency guide. So there's 2 pages I want to just touch on. The first is, again, a mental health continuum that you can be looking at, that will kind of give you some ideas. Are you in the green? Are you in the yellow? Should you be concerned and now in the red? And that will lead you to make some decisions about yourself about what kinds of support you might need. So I would like you to take a look at it. Don't be shy. Go on Google and just hit Working Mind. But to give an example, changes in mood. Healthy or normal mood fluctuations. You're remaining calm. You're confident. In yellow, you're now becoming irritable. You're maybe impatient. You're nervous. Maybe you're sad. Once you start reaching orange, it means you're now angry and you're starting to show anger. Anxious, pervasive sadness. You're always sad about what's going on. And when you're red and you really need help, you're easily enraged. Kind of like road rage that happens and you can't control it anymore. You're excessively anxious or excessively panicking and you're having panic attacks, or a severe depressed mood, or you feel numb. Other things are like changes in behaviors and performance, physical changes, changes in addictive behaviors. Are you becoming more addictive with certain things? And it doesn't have to be just substances. It could be video games, it could be TV, it could be other things where those behaviors are interfering with your normal lifestyle and you're no longer finding a balance in your life. The last thing are some ideas you can do. I'll mention a few, but again, you could check on this website yourself, and I hope you do. Some ideas. Write in a journal. Volunteer for a cause that's meaningful to you. Make a gratitude list. Take a fresh air break. Get out there and walk. Now's the time. Meditate or listen to guided visualization. I cannot say enough about the value and the power of meditation. I try to do it every day. I suggest the same. It'll change your life. Cuddle with your pets if you have any. Treat yourself to a nice meal and go through the time, get the ingredients, look up the instructions and explore a new meal for yourself. Listen to music. Practice yoga. Lay in the grass, what grass there might be left. Photography. Read a good book. Write a blog. Spend time outdoors. Go for a drive. Join an online social club in a good, healthy way and keep it limited. Look at podcasts and look at, like for TED example, play a game, dance to yourself in your own rooms, in your own house. Wear something and things that make you feel comfortable. Working in the garden and what's left of our garden. Try a new hobby. Explore something different that you've never tried before. Have an adventure day and go out on an adventure. Be creative. Spend time with children, either your children or other children in a healthy way, of course. Create a poster with images of a positive vision that you want for our community and put that on your window. Maybe others will do the same. And finally, nutrition. Increase your good, healthy food choices. Again, these are just ideas, but the end of it is all of us have these skills and our lives have not ended because of COVID. The big key is how can we have meaningful lives during these challenging times and remain healthy up here as well as in here. I wish you all the best. I offer all of you I greet all of you as my brothers and sisters, and I wish all the best for each one of you. Kahnawke.
And thank you very much. Thank you very much for that, Derek. And again, if you need to access their services yet again, just give them a call at 450-632-6880. Well, that'll do it for us on today's update. We'd like to thank you so much for joining us, taking time out of your very busy days. We hope that the information has been helpful to you. Lloyd mentioned a little earlier that the testing site is open. If you are one of those who needs to get tested or you feel the need to get tested, you can call the Cattery Memorial Hospital Center at 450-638-3930 and they will take care of you. Also, we mentioned that you can check the QR code on that graphic that we ran a little bit earlier, and that document will be available at www.kahnawake911.com, and you can also access it at covid-19.kmhc.ca. That's it for us. We shall see you next week. Take real good care because these are difficult times. They really are. So wash your hands, keep your social distance, and take care. Kahnawake.